there are different kinds of strokes. A stroke is when there is damage to the brain because of a vascular problem. In other words, the blood vessels are messed up somehow. You're not getting good circulation. So the two main kinds are, you get a stroke if there's a clot that sometimes, like in your carotid arteries, that clot will form and it'll break off and go up into your brain. And it goes until it reaches a place that's smaller than it is, and it just plugs up that artery. And when it plugs up that artery, then the blood stops to that part of the brain. And without a constant blood flow, the brain just quits working. And that's what a stroke is.
Hello, everyone. Welcome to the Healthy Heart webinar. It is a beautiful Thursday. I hope that you guys are all well. We are actually just waiting for Dr. Saunders to hop on. So I wanted to just start to let you guys know that we are here. We're just waiting for him. Sometimes he's with patients or has some other things going on, and so he's not able to hop on immediately. I guess we'll allow that. He can help people first before he hops on. But we're glad that you guys are here. Say hello in the chat when you guys hop on. If you are new, we'd love to hear from you. So post that in the chat as well. If you are on YouTube or Facebook, comment. We'll do our best to answer any questions that come up as we go today. Kathy is here from Illinois. Hello. And guys, this will be recorded. I get a lot of questions about that. And this is episode number 32 of our Healthy Heart webinar. And that is going to be on YouTube. You can find a link to our YouTube channel at bartonwebinar.com. And make sure that you subscribe to it, because there are so many great webinars. I want to say we're getting close to 240 webinars.
Yeah.
No. I'm wrong. 250, because yeah, we're over 250 already webinars over there. Just a lot of teaching with Dr. Saunders. And if you've been around, he is a phenomenal teacher, and he researches and he's learning all the time. And so it's just a real treat to be able to really tap into his mind a little bit about our health. We sure learn a lot every day. So I love doing these webinars for that reason. If you're new here, I'm Leslie. I'm one of the hosts. We have Cheryl here as well. We're both a part of the Barton team. And like I had mentioned, we're just waiting for Dr. Saunders to hop on. We don't want to try to give you guys any medical advice. No. So, I mean, we could try, but it would not be correct probably. So we won't do that to you. And I will just give you a disclaimer before he hops on as well. He is not your medical doctor. And so we would just ask that you maybe chat with your health care person before you implement any of the things that we discussed today. And a lot of the information is for general purposes only. So it looks like we have Ronnie is back. How are you? Ryan Kelly is in the house. Hello, Ryan. Lloyd from Hershey, Pennsylvania. How are you, Lloyd? Good to see you on here. Wanda from Canada. Delbert is here from New Mexico. Johnson's in the house. Go Cowboys. Oh, you're so funny. Okay. Judy is here from Kansas. Awesome.
Wanda from Newfoundland, Canada. That's great. Hello from Buckeye Lake, Ohio. Your program is a genuine jewel. Aww.
Oh, I love it. Ronnie, first time for the high blood pressure webinar. Oh, cool. Okay. So, yeah, we definitely will talk about high blood pressure, with a focus on our heart. So this is good.
We're going to talk about the Healthy Heart Solution Kit.
Yeah.
I need to make Dr. Saunders visible to all of you. Give me a moment.
No. Am I invisible?
Invisible.
We thought your superpower was treating patients, but it's actually being invisible.
The invisible man.
The invisible doctor.
Oh, yeah.
Where will he be tuning in from today? Let's see. Wait for him to turn an office.
Yeah.
No longer in Paris. So where are you tuning in from today, Dr. Saunders? This is your new location.
My new location in Solvang.
Okay.
Yeah.
This is the women's clinic, is that right?
Yes, it is actually.
Awesome.
But you're not just treating women. Your practice is treating anybody who comes to you. But
right. Yeah, we have 3 different practitioners in the office on Thursdays there's a psychologist that's doing counseling, and then there's me, and then there's the women's health. She's a nurse practitioner.
And Dr. Saunders, tell us again about all of the hats that you wear in the medical field, functional medicine. Sometimes I even get confused. I mean, you've done so many things, but what are you doing now? What do you do during your days?
Okay, so during my days, people come in. Okay, so today, for example, I had somebody in who had a heart attack. He had COVID. He almost died. Oh, I'm sorry, I said that word again.
That's all right.
he was like, and his wife called me and said, I'm really worried about my husband. He's really sick, and he tested positive for that virus thing. And so we wanted, but I don't want to take him to the to where they treat sick people, because I've heard that most people who go there don't come out. So so she called me and she said, "What can we do about it?" I said, "Okay, here's what we do. We have a protocol." And FLCCC website has a protocol, and I went on. We started their protocol. So I went to his house, took care of him and everything, and then after that, he got better, and he was like, man, it was bad. He was really, really sick, but he pulled through, and he's okay. And then he has a heart attack. So then he's got to go to the cardiologist, and he ends up in the hospital for a few days, and his heart's not functioning very well. And so then they come to me and say, can we get his heart function back, improved? Because it was really low functioning, and his lungs were filling up with water. And so he couldn't lay down and sleep at night, because laying back caused the fluid to come up, and he felt like he was like choking, like suffocating. So I said, okay, we have ways of doing that too. And so anyway, so he's back now. This has been 6 months since the heart attack. And he's back to walking 3 miles up and down hills. His heart rate can get up to 138. 139 was his highest heart rate. He wears one of these wristwatches that monitors everything about what he's doing, his oxygen level and all that. So he comes in with numbers, and I can see all the numbers. Okay, boom, this is better, this is better, this is better. And so he said, and he's going all day. He's still working. He's 79 years old, and he's still he's a insurance salesman. He's working. And he's remembering things, and he says, yeah, my mind's working just fine, and now my heart's working just fine. And so he's pretty excited to see his cardiologist, but I'm like, your cardiologist is not going to be impressed. They should be,
right,
but he's not. Yeah. And then I had somebody else came in who was fatigued, and so we'd done a lot of different studies and tests on why she was fatigued. And it turns out she has a problem with her aldosterone. It's an adrenal hormone. She has an adrenal issue. So now I just sent her out for more testing on why. So you start out with what's wrong, and then you ask the question why. Mm-hmm. And that's where we're working on right now. So that's what I do.
But why don't you just give pills for those things?
Yeah. Well,
why.
Well, that's what their doctors were doing. Just give pills. In fact, the first guy with the heart attack said, how come my cardiologist is telling me this and you're telling me the opposite? This is so frustrating that I'm getting these two like widely differing opinions. It's not like you're a little bit different, like you should take this pill and no, you should take this pill. It's like you should not take pills. It's like so opposite. He was really frustrated. But here's what's happened now. Because of his wife said, no, we're following Dr. Saunders' protocol. So he went down and down and down on the pills. He's taking like a half dose of the pills, because the cardiologist said, you have to take them. So he goes, okay, I'll take them. And so he's taking a half dose. And his exercise tolerance has increased dramatically. And he's working all day long and functioning well. So his functional level has returned. And so, you know what? I get excited about that. I think that is so cool.
Yes.
I have so many questions. So you're at this clinic today. Are you at other clinics on different days?
Yeah, Tuesday and Wednesday, I'm in Goleta. And I also am in the office of a nurse practitioner. And the nurse practitioner also does mostly functional medicine, but she does a lot of children's health and stuff like that. Primary care stuff that I don't do.
And so for this guy who had a heart attack, what were his risks? Because we know cholesterol is not that risk. So what were his risks that made him have a heart attack?
The corona.
That thing.
Yeah.
Oh, man.
Yeah.
And we've talked about that on some of the webinars too. And guess what? We can't even talk about it right now because then we get banned and they shut down our YouTube. So you can draw your own conclusions about that. In fact, you can go to other websites and find all the information. So I don't always know why our channel gets banned, but
Yeah. But it's not the beer.
we'll call it, we can call it Corona Light beer from now on. That works.
Yeah, that's what we can
Okay.
do.
All right. Okay. So here's the deal. We won't be talking about beer on this program today anyway, but we are going to talk about strokes and the heart. And I'm excited to chat with you about this, Dr. Saunders. I want to learn a little bit more about what's happening in the body when someone has a stroke and what do we do to prevent it? What are some of the things to watch out for to make sure that we're keeping ourselves healthy? But before we dive in, I'm going to ask a question because this came up in our chat and it's kind of a random question, but Kathy wants to know what the difference between vitamin D and D ribose is.
Okay. Vitamin D is a hormone. It's actually made by your body, and you make something called dihydrocholesterol. And then that dihydrocholesterol goes into your skin, and then the sunshine comes and hits your skin. It's a very high energy ultraviolet ray that comes and hits your skin and changes that dihydrocholesterol to provitamin D. And then that provitamin D goes into the liver where it's made into vitamin D2 or D3. And then from there, it's made into 125 dihydroxy vitamin D. And that is the vitamin D that makes you, that helps you to absorb calcium. So you absorb calcium from your intestines because of that. It stops the kidneys from letting calcium go. It also stimulates the cellular immunity, the macrophages. So the vitamin D binding protein is macrophage activating factor. And every cell in your body has receptors for vitamin D. So it has effects all over your body, especially with the immune system and the calcium regulation. But that's not all it does. In fact, we like to compartmentalize things and put things into this fits here, this fits there, this does this, this does that. The way the body works, there are multiple functions for like vitamin. You say, oh, this vitamin, like folic acid, is really important for energy. Well, it also helps you methylate, turn on and off genes. There's so many things and detox, and there's so many things that it does that it would boggle your mind what vitamin D does, but a lot of things. Okay, and D-dimer is completely different. D-dimer is a part of a protein that when you form clots, when you make clots, there are certain parts of proteins that are cut off. So you have this protein, a fibrin, for example, or fibrinogen, that is inactive. It's swimming around in your blood and just minding its own business and doing nothing. And then there's something wrong, like damage to one of your arteries, or there's a cut. You have a cut in your body, and so then that fibrinogen gets cut into fibrin, and fibrin starts making these chains that form clots that block up, that plug up all the holes. And that's what clotting is, and so that you don't bleed out, right? That little extra piece that gets cut off is called D-dimer. And so that's how you know you're making clots, is measuring that.
Is that the same as D-ribose though?
I'm sorry, D-ribose. I was thinking D-dimer.
No, that's
Okay.
good. I've never heard you talk about that. So that was interesting.
Yeah,
But
D-dimer.
yeah,
Okay, no, D-ribose. I got mixed up.
you
Okay,
just know too
no,
many things. You got too many things in your memory.
ribose is a sugar. And it's a sugar that's made, it's in a lot of plants and stuff in small amounts, and you make it in your body. But if you don't make enough, then you can't make ribonucleic acid, RNA, or deoxyribonucleic acid, which has that ribose in it. So the DNA and RNA are actually made out of, the structure of DNA and RNA are made out of ribose. And so you have to have ribose or you can't reproduce cells. You can't change your DNA. You can't make your RNA. So if you don't have RNA, you can't make proteins. So that's why that ribose is so important. And the D is just means dextrorotatory. It's a right-handed one and not a left-handed one. Left-handed is levo, is the L ribose. The D ribose is the only one the body uses, does not use L.
So both vitamin D and D-ribose, your body makes these. One is a hormone,
Yes.
one's a sugar.
Yes, exactly.
Very
Something
good one.
Thank you.
Okay.
Thank you.
I got my hands in there too. See?
Yeah,
Just like
yeah. And Leslie, you make it so clear. I'm glad you clarified that.
That's funny. That's how my brain works. I have to make it real clear, otherwise I don't understand. Okay, but Kathy's wondering then, can you take both D-ribose and vitamin D then, since they're different and they do different things?
Of course. Yes, absolutely.
Perfect. All right. All right, well, let's do this thing, guys. I'm excited to learn. Let's dig in. I already did a disclaimer before you got on here, Dr. Saunders. So what is happening in the body when someone has a stroke?
Okay. There are different kinds of strokes. A stroke is when there is damage to the brain because of a vascular problem. In other words, the blood vessels are messed up somehow. You're not getting good circulation. So the two main kinds are, you get a stroke if there's a clot that sometimes, like in your carotid arteries, that clot will form and it'll break off and go up into your brain. And it goes until it reaches a place that's smaller than it is, and it just plugs up that artery. And when it plugs up that artery, then the blood stops to that part of the brain. And without a constant blood flow, the brain just quits working. And that's what a stroke is. There's another kind of stroke, which is less common, and that is usually from an aneurysm. You have a blood vessel that has a bubble on it because the connective tissue is soft or is not really strong in that part. So it starts forming a bubble, and the bubble gets bigger and bigger, and just like a balloon, eventually it's going to pop. And when it pops, then that blood vessel starts leaking out and creates a clot inside the brain and does damage to the brain. So then that's the other kind. If it's a large aneurysm, they can cause death. If it's a large embolism, then that can cause death too. So sometimes people die from strokes because the brain quits working. Or if it's in a place that's really important. So people have strokes in the pons or the brain stem, and the brain stem is controlling breathing and heart rate and all that. And so if that gets blocked up, you completely lose control and you can die from that, even a small stroke if it's in the right spot. Other strokes, there are a lot of teeny strokes that people don't even know they have. So we'll do MRI scans on people. Someone will come in with, you know what, I'm feeling weaker than usual, and I don't know why. There's nothing really bad, just I don't know, a little different. And so you do an MRI scan and you find tons of little teeny strokes all over the place. And they call it, there's something called multi-infarct dementia. And that is where you get multiple little teeny strokes. Why does that happen? Well, little teeny clots are forming in your blood vessels. They're not supposed to, but they can happen. And if they do, think about this, 20% of the blood that comes out of your heart that's being pumped out of your heart is going to your brain. So if those clots that are being formed go through your heart, if they end up in your brain, then you're going to have a little teeny stroke, and you may not even notice it. In fact, it's surprising how much brain can be lost before somebody actually notices. There was one case of a child that had hydrocephalus. It was a baby with hydrocephalus. They didn't know the baby had hydrocephalus. Seemed like a pretty normal baby, and then they noticed, some things were wrong, and he wasn't acting normally, wasn't doing things right, wasn't learning and proper movement. So did an MRI scan, and his whole brain was full of water, and all he had was a little bit of brain cells just lining the inside of his skull, and the rest of it was all just water, just the cerebral spinal fluid. It's just surprising how much brain can be lost before people notice it. Now, if you have these little teeny clots and they go somewhere else in your body, if they go into your liver, who cares? The liver doesn't care. It's not going to make any difference at all. If it goes into one of your muscles, no big deal. It's not permanent anyway. And there's other alternative circulation. Eventually it'll get what it needs. No problem. So these little stroke clots going to other parts of your body, no problem. But when they go to the brain, they do damage. The brain is like really important. If you lose circulation to a small part, then that small part dies. And that little small part dying shows up as little white marks on an MRI scan. And so the radiologist says, oh yeah, there's multiple infarcts, white matter vessel disease, they often call it on the MRI. And all that blood vessel, what all that means is there's the small blood vessels aren't working either from little clots. And that brings us to the third kind of stroke, and that is the blood vessels aren't working properly. So if you can't get blood flow because your blood vessels are closed off, narrowed, not functioning, then you also get these little teeny mini strokes that are happening continually and damaging your brain that you don't even know about until you start having a problem, and they look at it and go, oh my gosh, you have white matter small vessel disease. It's the same, and this is important for people that have diabetes, because especially type 2 diabetes, you get the same small vessel disease in your feet. And that's why you get neuropathy of the feet. The nerves are being damaged from this small vessel disease. Well, the brain is having the same problem when it's getting damaged. And sometimes people that, especially older people with small vessel disease, their brain actually shrinks down, and they have less and less brain because they're losing brain tissue from this small vessel disease that doesn't allow blood flow.
Did you say at one point that these clots start in the heart?
Sometimes they do. So people that have atrial fibrillation, the atrium is not fully contracting, pushing the blood out, so it doesn't flow. The atrium is going like this. And so the blood is just kind of circulating around in there. Yeah, there's blood flowing through the atrium into the ventricle, but it's not pushing the blood out. So this blood that's kind of just circulating around in there starts forming little teeny clots, and then eventually that'll go down through, and then 20% of all that blood is going to the brain. So if they end up in the brain, then they clot. So yes, it can come from the heart. But it doesn't always come from the heart. But yes, that's one of the possibilities.
I feel like I hear of a lot of people that go into the hospital after having some type of medical situation, and I hear, oh, they think he or she has had some small mini strokes. I hear that a lot. And what do we do to prevent this? How is this happening? What can we do? What lifestyle things should we be doing?
Okay, that's a great question, because the reason we're in this discussion is heart disease, right? And we've gone through this. What causes heart disease? Well, it's the blood vessels. Oh, so the blood is not getting to the heart muscle, And that's why people get heart disease. Well, that's most of the time, not always, but that's the vascular, the atherosclerosis, all that heart disease. So that's the same thing that's going on with a stroke. So then what we, in our discussions of heart disease, go, well, why does that happen? Well, it happens because clots are forming in the arteries of the heart. And those clots are not getting resolved and organized very easily. They're not repairing properly. So you get more and more and more and more clots, and eventually you block off, it clots off, and you block the artery entirely, and then the heart doesn't work. Well, strokes are the same kind of process most of the time. You know, you can have an aneurysm where it can blow up, but all of the rest of them have to do with vessel disease. So either small vessel disease or clots forming. And clots can form in the large arteries, they can form in the small arteries, or they can form somewhere else and go up into the brain. No matter how you look at it, that's all clotting, right? It's all blood clots. So the way to look at this is to look at how to prevent clots from happening. And that's what we're all about. That's what we're talking about. That's what the whole healthy heart solution kit is all about, is about how to prevent clots and repair vessels so that you don't have vascular disease. And that's why the strokes are related to heart disease. The relationship is the blood vessels and blood flow, and the clots that form that cause the disease. Clots in the heart cause heart disease, clots in the brain cause brain disease. Either way, you got to stop the clotting.
So I did hear a message of hope in there. You said that we can prevent these clots, but you also said something about repairing. And so that is something that is possible, correct?
Yeah. Okay. So having small vessel disease, the blood vessels need to be repaired. And it's not good enough to just stop clotting, because if the small vessels are not getting blood through them, then your brain's not getting enough circulation, and you're going to have more damage to the brain. So you still need to repair those small vessels. One of the things that we talk about is to have an omega-6 to omega-3 ratio. Now, I sent out an article to all my patients, and it's in Home Cures That Work. It's like, I think it's the best article I've ever written. I know, right?
Time out. How many have you written? How many articles do you think you've written for Home Cures That Work?
Cheryl, can you help me with that?
I can figure out. We are going to be 15 years. So 15 times 12, he's written 180 articles for Home Cures That Work.
Okay, hold on though. We're not done. We got to do it before you go into this. We got to do a little Home Cures That Work blurb, because you guys, if you don't know about this, this is a really, really big deal, and you want to be a part of this and you want to get this. So I'm going to let Cheryl just chat about that really quick.
Well, I was going to ask you, which article do you think is your best article? I was going to link that one. Your Omega article? Or
the Omega article.
Let me get that for you. Let me put it up.
It's going to be the best one until next month when he writes another really good one.
He writes a very interesting article about the J curve.
Oh yeah, that was very interesting. And I learned a lot from that too. But the Omega article was groundbreaking because there is so much misconception about fats. And you know, if people were to just go by what they hear, like in advertising and from cardiologists and from their doctors and from whoever else, they would be so confused, and you wouldn't even know which end was up. Okay, what is saturated fat? Do I eat saturated fat or not? What is it? What is omega-3? What's a PUFA? What's a HUFA? You know, what are all these fats, and what is the difference between fat and oil and lipid? And this article just outlines everything, simple definitions of each of the terms. So by the time you're done, you're like, oh, that's a HUFA. Oh, that's a PUFA. That's an omega-6. That's an omega-3. Oh, that's a saturated fat. Well, I know what that is, and I know why it's a saturated fat, and why that's important, and why this the monounsaturated fats in olive oil is important. And you just learn, just like every little thing about fats, so that when somebody tells you shouldn't eat saturated fat, you can ask them why, because and you'll find out they don't know. They have no idea. They'll say something like saturated fat makes cholesterol. No, saturated fat is totally unrelated to cholesterol, and it says it in the article. Anyway, so but this omega-6 to omega-3 ratio turns out is really, really important. I wish I could show you the graphic.
Here, is it in the article?
Yeah.
Yeah, it's in the article.
Okay, I'll share it.
The lower the omega-6, the less vascular disease you have. Yeah, everything you ever want to know about fat and more. Oh, yeah, what are lipids? Okay, keep going. Keep scrolling. And
oh yeah,
okay, that's saturated versus unsaturated. Yeah, those are the triglycerides. Oh yeah, you learn what a triglyceride is. Omega-9s, omega-3, omega-6. Yeah, isn't that awesome?
Mm-hmm.
Inflammation. Okay, okay, wait, stop right there.
You got a lot of information in here.
Yeah, this is really big. Okay, look at this graphic right here. So this is, you have omega-6 on one side, omega-3 on the other, and in between the two, you see these, they're enzymes. The omega-6 uses the exact same enzymes as omega-3, but it's going to make these pro-inflammatory mediators, whereas the omega-3 is going to use those exact same enzymes and make anti-inflammatory. In other words, it's going to suppress inflammation. That's really important, because if you eat omega-6, then that's what your cells are made out of, and you get pro-inflammatory mediators. If you eat omega-3, then that's what your cells are made out of, and you're going to get anti-inflammatory mediators. This is like really basic and so important, because the enzymes are the same. Your body doesn't care. Your body is not going to distinguish. It's just going to say, oh, we need some thromboxane, and then so it'll make that. And if it has omega-6, it's going to cause inflammation. If it has omega-3, it's going to suppress inflammation. That's why that's important.
This reminds me how you need to choose your friends wisely, because those enzymes don't change. So you can have really not good friends if you want to hang out with the omega-6s. Yeah. And you won't do good things. But if you want to be friends with omega, you're fine.
So go to the next one. The next one right here. Okay, so look at this. The purple is omega-6. The blue is omega-3. Look at how every single oil has omega-6. And look at how many have omega-3. Only 2 of them have significant amounts of omega-3. Flaxseed oil and salmon oil. And that's it. Everything else is mostly omega-6. You cannot avoid omega-6. So people tell you, oh, that omega-6 is an essential fatty acid. You better take it. And so you learn in this article, no, you do not want to take pills of omega-6. That is a bad idea, because that's going to cause inflammation, number one. And you can't not get omega-6. You can't avoid it, is the point here, so that you can't be deficient in omega-6. But it's pretty darn easy to be deficient in omega-3. As you can see, if you're eating sunflower oil, there's 0 omega-3. If you're eating safflower oil, there's 0 omega-3. If you get cottonseed oil, and guess what? All of your potato chips and corn chips, guess what it's all boiled in? Sunflower oil, safflower oil, cottonseed oil, corn oil, canola oil. And these are all very low omega-3, very high omega-6. So the average American, go to the next one, and you'll see this average American one. Look at this. Okay, look at this. Mortality. So this is cardiovascular disease mortality. Look at the difference between Greenland, that has about a 30% of their tissue highly unsaturated fatty acids, is omega-6. So they're 30% omega-6. And look at in the American, the USA studies, the Mr. Fit study, all the blue ones. And the blue ones are the United States studies. And look at where they're 80% omega-6. And they have 10 times the amount of cardiovascular mortality. 10 times. We're not talking about a 20% difference. We're talking about a 1000% difference between Greenland and the United States, just looking at the difference between the omega-6 percent omega-6. So you do not want omega-6, you want omega-3. So if you have 30% omega-6, that means you have 70% omega-3. Well, guess what they eat in Greenland? Do they
Fish.
grow any nuts in
Fish.
Greenland? Do they grow any seeds? No, fish. They got nothing but fish. Fish for breakfast, fish for lunch, fish for dinner. What? Because they can't grow anything there. I don't know. They have to import stuff if they're going to import stuff. So I'm sure, yeah, maybe they get bread and maybe they get some vegetables and stuff imported. But they certainly have a lot of cold water fish. And so their omega-3 levels are really high. And this is a huge difference between 20% mortality, or 20 per 100,000 to 200 per 100,000 in the United States. So we're talking about strokes today, I know, and not heart disease, but this is the mortality table. The vascular disease. This is kind of like one of those bottom line things that you have to fix.
And so not only do we want to eat less omega-6, we can counteract that by eating more omega-3, correct?
Yes, both less omega-6 and more omega-3.
Okay.
I've heard Dr. Boz. She is an author and a doctor who is a big proponent of the keto diet. She was talking about a study about people who are in the ambulance having and experiencing a heart attack on the way to the hospital. She was saying the factor that determined whether or not you were going to survive your heart attack was your omega ratio. If you had a higher omega-3 ratio, then you had 90% chance of surviving your heart attack. If you had a lower omega-3 ratio, you only had a 10% chance of surviving a heart attack.
Wow.
Yeah. I don't know.
Just be popping those fish oil pills all day long? No, that's an option.
Yeah, well, that's why we have them available now, because
Yeah,
it was a big deal when we started looking at why that was important. Because in the United States, like we showed on that one graphic, if you're eating oils, you're getting any kind of oil you eat. If it's not just like salmon or flax. By the way, chia seeds are very similar to flax. So chia, flax, salmon oil, or fish oil, those are good sources of omega-3. And the reason they're good sources is because they don't have omega-6. So people are saying walnut oil is really good because it's high in omega-3. Yes, it is, but it also has a lot of omega-6. So it's not really a good source of omega-3 because your ratio doesn't change. And that's what Cheryl was talking about. The ratio is ultimately most important.
Can you guys hear me?
Yes.
Yep.
Okay, for some reason you guys are frozen. But anyway, here's the omega-3, just so that you guys know. You can find it at bartonnutrition.com. Use code webinar25 if you want to purchase this, because you'll save 25%. And webinar 25 is one word. But look at that beautiful bottle. I mean,
I love that color.
Or you could eat salmon, some wild caught salmon, which would be a good option. It's going to taste better than that probably, but I would rather eat my food. But this is a really good option. And because you know what? It is sometimes hard to get the right amount of omega-3.
So most of your seed oils, almond oil, for example, somebody asked about avocado oil. Avocado oil is very similar to olive oil. So it's got a lot of omega-9, not a lot of omega-6 or omega-3. And I think in avocado oil, I don't know what the ratio is, but I know in olive oil, it's 13-1. So there's 13 times more omega-6 than omega-3 in olive oil, but it's a small amount. So it's mostly omega-9. So you're not getting a lot of those PUFAs, the polyunsaturated fatty acid, the omega-3 and 6, you don't have a lot of that in either avocado oil or olive oil. Almond oil is a little more omega-6, has a lot more omega-6 than omega-3, but there's not a lot of those in there either. So one of the surprising things for me was sesame oil. Sesame oil, I always thought that was really good oil. But it turns out that it's not. Doesn't have any omega-3 at all. So
I just
anyway.
used a little bit of that last night too. Shoot.
Well, the olive oil is working for those who are following the Mediterranean diet. So
Yeah.
that must
Yeah.
be a thing. I wanted to ask about what is brain hemorrhaging and how different is that from a stroke, and is that related to any heart health?
Okay, so brain hemorrhaging is the aneurysm stroke, and that's where you pop a blood vessel in the brain. And you know, the reality is we pop blood vessels everywhere a lot. And people, have you ever seen somebody with like a bright red eye? Their sclera is like just like bright red. Well, that's because a blood vessel popped in the sclera, and it's obvious because it's so obvious because it stands out red, you know. It's not by itself a problem. We pop blood vessels in our skin and muscles and all the time. In fact, have you ever heard of warfarin, Coumadin, which is rat poison? And what is it? It's a blood thinner because rats pop blood vessels all the time too. And if they can't clot them off, then they bleed to death. So they die from internal bleeding from just, they pop the normal popping a blood vessel. And so the rat poison is just a blood thinner. So what happens in the brain is you pop a blood vessel, just like people do in their eye and they do in, you know, other parts of their body. But in other parts of your body, it doesn't do damage to pop blood vessels. You get a bruise, big deal, you know, and then that resolves and you're fine. But your brain's really sensitive. And so if you pop a blood vessel in the brain and then clot that off and create a clot in there, so you're number one, you're putting pressure in that area. Number two, you're stopping the blood flow. So that's really damaging to the brain. And if it's a small vessel, you don't notice it. They're tiny, the tiny arterioles, you're not going to notice it. But if it's a big blood vessel, it can do a lot of damage. That's a hemorrhage. That's a brain hemorrhage.
Okay. Question here from Jerry. What is your best product to remove trash in your blood vessels in my left foot and leg?
Okay, so number one, fasting. When you're fasting, you go into what's called anabolic mode. So you have two different types of metabolism. You have a catabolic metabolism where you're breaking down, like when you're eating, you're breaking down your food, you're exercising, you're breaking down your muscles. And that's all catabolic literally means breaking down. And then you have the anabolic metabolism that happens at night when you're sleeping and fasting. So if you're not eating anything, then you go into anabolic mode and then you repair your blood vessels, you repair your heart, you repair your brain, you repair the damaged muscles that you did from exercising. All of that stuff is repaired when you're in anabolic mode. So fasting, the 6-10 reset, stop eating after 6, go to bed by 10, and then wake up in the morning and have breakfast. In fact, skipping dinner is probably a good idea, and then eat breakfast. But going to bed by 10, and that gets you into anabolic mode. And then your specific question was a product, and the point is that taking the pill doesn't work unless you're in anabolic mode. So that's why I wanted to emphasize that first. And then you can take Nervala, which has alpha lipoic acid and benfotiamine that actually repair blood vessels and repair the nerves in the tiny blood vessels. So, I was talking about the stroke. People that have microvascular disease and white matter disease in the brain on an MRI scan, I always put them on Nervala because that's one of the things to repair the tiny blood vessels. You need benfotiamine, which is in Nervala.
And you can find that at Barton Nutrition as well. And again, code webinar 25 to save 25%. Another question here. We're running out of time. This has been good. Okay. Ronnie said, could you talk about platelets, please? I have a high platelet count and donate regularly. Is that why my blood pressure is high? I'm on a statin, fenofibrate, and atenolol. Pardon the spelling. I would like to get rid of this medication. Most of my adult life, I've had a 90/70 or thereabouts.
90/70 blood pressure, that's low. Is that right?
The top number is low for sure.
Yeah. Well, Yeah, the top number. Yeah, that's 90%. Anyway, wow. Okay, so platelets. When platelets are high, it's an indication of an inflammatory condition. And so, so what you need to know is, okay, the platelets are high. Now your next question is why? Because if you don't know why they're high, if you don't know why the platelets are high, then is it a bone marrow problem? Is it an inflammatory condition? Do you have a hormone imbalance of some kind? Is there a kidney problem? Is there a bone marrow problem? Sometimes it's a metamyelocyte problem of bone marrow, the cells in the bone marrow. So looking at why that is really important. And then looking at other things is, why is your cholesterol elevated? Why are these, blood pressure is low? All of these issues are probably related in some way. And so finding out why is the next most important thing. So start testing, looking for inflammatory markers, and look at your hormone markers, look at the aldosterone to renin ratio, and the adrenal, test your adrenals. So that's a good place to start, is with finding out why your platelets are elevated. Usually it's some inflammatory process, but there are a lot of other possibilities.
Okay, Isaac says, how do you raise your ejection fraction?
Oh, hey, that's perfect. Remember my patient this morning that came in this morning? He had an ejection fraction of 20 to 25%. And that is barely compatible with life. In other words, the ejection fraction is your heart beats. And when it beats, if it's 100%, that means all of the blood gets pumped out. If it's 50%, that means 50% of the blood gets pumped out each time it pumps. If it's 20%, that means only 20% of the blood is getting pumped out each time it pumps. So that's why ejection fraction is really important, because if you're only getting 20% of the blood out each time, you have to pump a lot more times to get the same amount of circulation as somebody who has a 70% ejection fraction, where they're getting 70% of their blood out every time. So that's a very important thing, and you want to raise your ejection fraction. Well, that's what we did with my patient that had a 20 to 25% ejection fraction. We started him on a series of nutrients, and the L-carnitine, D-ribose, coenzyme Q10, and magnesium are a good place to start, because those are often deficient, and they're required by mitochondria to, number one, repair and replace mitochondria, and number two, to make energy. So the problem in the heart is when there's an ejection fraction problem, it's usually a lack of energy. Now, remember, if somebody has clots in their arteries and they're not getting enough circulation, what's the problem? A lack of energy. You say, oh, there's not enough blood going to it. Yeah, but what does the blood carry? Well, it's oxygen and nutrients and sugar and all the things that those cells need to make energy. So that's why the blood flow is so important. But to build those mitochondria to improve your ejection fraction, you need those nutrients to increase the mitochondria. So they don't work. The nutrients don't work unless you exercise to your limit. Now, whatever that limit is. So if you have a low ejection fraction, then you're going to have a lower limit. So maybe your highest heart rate can only be 110, 105. The test, when they do stress tests, cardiologists usually use like 180 minus your age as an ideal, but kind of look at it as you need to stress your heart a little bit, but don't overstress it to the point where you get heart failure and your lungs fill up with fluid, right? You don't have to push it that hard, but you have to reach your limit. And so test your limit, reach your limit. You may ask your cardiologist if you could do PT, coronary or heart physical therapy. And if you do And then the physical therapist will be able to say, okay, here's your limit. And then you can do exercise up to that limit. And then you do that several times a day, or whatever it takes. Because if you don't stress the heart, it's not going to repair. And then after that, do the 6-10 reset, where you stop eating by 6 p.m., go to bed by 10 p.m., so that you can get into anabolic mode and actually do the repair. Because if you don't make the human growth hormone, which is you make it 10 o'clock at night if you're asleep with an empty stomach, then the human growth hormone will induce stem cells to repair damaged arteries, damaged muscle, and it repairs literally everything in your body, from your brain to your joints to your muscles, nerves, everything.
I wish there was a pill for fasting. Wouldn't that be fun?
Yeah.
A fasting pill?
Well, actually, there was. It was a company in Santa Barbara, and they had a weight loss pill. And all you had to do was you take the pill at 6 o'clock at night, but you couldn't eat after you took the pill because it was it wouldn't work if you ate after you took the pill. So you had to take it on an empty stomach, and then you couldn't eat afterward. People were losing weight. They were feeling better. They were doing great. And then somebody analyzed the pill, and it was just a sugar pill. And so the Federal Trade Commission put them out of business. And people were clamoring. They're calling, going, "Wait a minute! I need that pill. That's really important."
Yeah, that's funny.
It was a sugar pill, and the fact that they weren't eating after 6 o'clock, they were losing weight.
Yeah, that is funny. Well, proof that it works. Really good question here from Andy. Are there any lab tests that can be done to gauge omega-3 to omega-6 ratio?
Yes, it's an omega-6 omega-6-3 ratio. Quest has it. Every lab has it. So you just some of them are like, one's called Omega Check. Just look at whatever omega oil, omega fat test is going to have the 6-3 ratio.
But how long does that really? I'm just trying to gauge how that works, because what if I had salmon that day?
Okay, good
but the
question.
day before I didn't. So
good question. So what they measure is they take the cell membranes off of the red blood cells. So that's what they measure. So they draw your blood, they spin it down, they take just the red blood cells out, and then they take the cell membranes off of the red blood cells, and they measure all the different types of fats that are in the cell membrane of the red blood cells. And that is an indication of what you've been eating recently. So if you just had salmon yesterday, and your bone marrow has been making red blood cells out of it, then you're going to have a little bit higher omega-3. But remember, that's going to be averaged out over a period of time. So the red blood cells last about 3 months or so. So if you just ate salmon today, then you're going to have maybe a little higher because it's averaged out over 3 months.
Okay.
So it's kind of like your A1C, which is a measurement of 3 months for your blood sugar. Your omega is a 3-month assumption of your omegas in your blood, like the average.
Yeah. Or the C-peptide, which is the longer insulin test. See all these things we're learning?
Look at you.
I know. These are all my notes that I've taken down, guys. I'm serious. I take a lot of notes so that I can understand. I love it. This is so good. Now I feel like I should go get mine checked.
Yeah.
Do that.
Yeah, it's really interesting.
Speaking of weight loss pills, I watched a short video that was talking about Ozempic, and Ozempic is now going to be turned into a blood pressure and a heart pill because they realize that when you lose weight, your blood pressure improves. Therefore, drug companies can now offer it, because it's a high costing drug, to people who want to improve their blood pressure.
Wow.
But the study, which is not released, it was just a press release, does not work on people who are diabetic. But that's what Ozempic is for. It's for people who are diabetic. It was just overweight people that lost weight and improved their blood pressure. So it's a very interesting piece
Wow.
of information, kind of awkward, if you would say.
Interesting.
Yeah, I saw that study, and I wasn't impressed either. I mean,
Yeah.
I looked at it, I go, it doesn't even work for them at all. And the very modest lowering of blood pressure was only in those who lost weight. And I don't know, it has significant side effects. It raises insulin and causes more insulin resistance. So I don't think it's a long-term solution.
No. Okay. Just want to make sure. What helps a lymphatic system function properly?
Lymphatic system. Okay. That's, we should the lymphatic system is like an entirely separate blood vessel system. It's like this whole vascular system, web network that's all over your body. And it's really weird. It's like alien. It's like so like weird. It's like they're, the blood vessels, you have red blood and blue blood, and the vascular, the lymph system is like filled with chyme, which is like a milky substance with fat in it, or lymph and it has like it's green and it's weird. It's anyway, and they're very tiny, and they have a lot of valves in them, so that one-way valves, so it can only move one way, and it has muscles in it, so they're like, it's like squeezing a toothpaste tube as it squeezes the lymph through, and then there's lymph nodes on there. So the lymphatic system is extremely important. And one of the most important things you can do to improve your lymphatic system is exercise. Movement is so important for your lymph system to function properly. So I had someone, it was yesterday or the day before, and his ankles were really swollen. I said, what do you do all day? Well, I'm sitting all day, literally, like all day long sitting, laying down in bed, the swelling goes down. And then during the day, he's sitting all day, doesn't move at all. And so we had to put him on, like, every hour he has to get up and walk for 10 minutes, and then he can sit down, and then get up and walk for 10 minutes and sit down. Just movement is so important for the lymph system to function.
All
There are
right.
also lymphatic massages you can do, and then there are things like dry brushing that help the lymphatic move. You can find videos online on how to dry brush. You can also do sort of a stone like gua sha, which is a little deeper lymphatic massage. So I do one of those to help my lymphatic move. But
Awesome.
you'll also have to open your what Dr. Saunders said, like the valves of your lymphatic system in order to clean it out. So they're like, these are your main lymphatic drainage nodes right here. And by just pressing on them, that opens up the valves, which help your whole body release the draining of the lymphatic system. So there are different parts in your body where you rub or open up the valves. Behind your ears, you can do it in the crux of your arm, behind your knees, in your groin area. So find some videos online and it'll help you.
We might have to do a webinar on the lymphatic system, since we've been talking
the lymphatic
about it.
system.
Plus, I
And
gotta
the
find some of these visual
lymphatic system in the brain too. Yeah.
Interesting.
And that's new, what Cheryl was talking about, lymphatic system in the brain. No one ever knew that existed. Everybody just thought, cerebral spinal fluid, that's all there is in the brain. But it turns out there's a lymphatic system there. It's really it's kind of weird.
Okay, we've had you for too long. Any quick thoughts about infrared light therapy?
Yes, infrared light is really important, and the best way to get it is from sunshine. And so, yeah, but they actually do make infrared lights that are very specific to turn on what are called chromophores in the body, which are sensitive to light, and it turns on your energy systems. And so light is actually really good for you. And but I'm telling you, sunshine's the best way to do it. So don't go out and waste your money on those LEDs. just lay out in the sun for 20 minutes. It's great.
Awesome. Okay, Dr. Saunders, thank you so much. We'll see you next week.
Okay.
And
Bye.
there was a question here from someone, is a lot of this covered in the Healthy Heart Solution Kit? There is a lot of good information in this kit. And so if you want to check that out, go to bartonwebinar.com. You can get this hard copy, or you can get the downloadable version, which is a little bit less expensive. And it's under $20, guys, for the downloadable version. So you can have that right away, dig in, really, really good stuff. We talk a lot about food as well in there. And I just think you'll really enjoy that, especially if you're looking to keep your heart healthy. So there may be a couple other questions that we can get to maybe next week. We kept Dr. Saunders a little too long, but hopefully he forgives us. Thanks for being here, you guys, though. We will see you next week. Cheryl, thank you so much. And that's it for us today. Bye-bye.